Hello. Today I have Dr. Meg Tazuli, and we are going to dive in and share as much as we can about girls with ADHD. Specifically, we're going to really try and break down a lot of those myths that are out there in the world regarding girls with ADHD. So, Dr. Meg, thank you so much for coming. I'm happy we finally got to coordinate our schedules to do this.
It's my pleasure. Thanks so much for having me. I'm excited to dive in and talk a little bit more about ADHD in general, and then specifically with girls.
Yeah, I can't wait to get all this information out. So I know Dr. Meg because we should actually share the same office space at Prac in South Miami, and she's kind of down the hall from me. And we have a couple of clients in common, but we really, every once in a while, she's like my go-to person. Hey, what's going on with this? Or I always run to ask her questions, and she is always great to answer them. And I know she has a lot of expertise with ADHD specifically, and we both are seeing a lot of girls coming to us with ADHD. So just before we get started with the meat and potatoes, just give us a little bit about yourself and share with us.
Sure. So I grew up in Miami, Florida. I am one of 6 kids, so I learned really quickly to navigate different personalities. And then my training is at St. John's University in New York, in Queens. And I was there for about 10 years. I did my undergrad and my graduate school there. My specialties are in school psychology specifically, bilingual Spanish speaking, and I also have a concentration in like education and law is what my
that's super interesting,
which is cool. So I have some cool like knowledge about like special education law in general, which has been really helpful for advocating with families for the needs of their kiddos. I worked in a school for about 6 years. And then last year I made the shift to private practice, which has been amazing. I've been able to support different families in lots of new ways that I wasn't able to when I was in a school because of the caseloads and the time management and such kind of limited resources at school. So it's been really nice to be able to support families differently in the private practice setting now.
Awesome. Great. And both I'm an occupational therapist. For those of you who don't know me, Nicole Santamaria, and I have a private practice, which is where I get to be Dr. Meg's neighbor. And I also go to a ton of schools in South Florida, and I work and support the children that have IEPs and 504s, in addition to also supporting the teachers in the classroom. So I think maybe that's what you and I have so much in common, because we both see what, and today we're going to talk about ADHD in girls. So we could both see what ADHD in girls looks like in the school setting, with support, in the school setting without support. And then we get to see it also in the clinic with private clients and private families, because the team at school, even though it's, parents and teachers, the support is set up very differently than it is in the private real world, right? Yeah. So it's cool if we can weave that into our conversation today.
Absolutely.
So one of the reasons that I wanted to bring this information here, which piggybacks on, I've been into so many schools and classrooms, and I see I feel like I'm like a fly on the wall, because I see it on both ends, and I see the struggles. And I really believe that the more information we can get to teachers, other professionals, parents, the better the whole village is going to be able to support that, in this case, that little girl. Because that little girl is going to grow up, and she's going to be a woman, a mom, and she's going to be a big part of the community. So we can really change the trajectory of how she shows up in her life, however she chooses to do it, if we can really support them at a young age. And I know, Meg, share with us a little bit about why you want to do it. I like what you said before we put the camera on about other colleagues as well.
So I have been seeing, in just like my peer group, professionally and personally, I've been seeing a lot of adult women getting newly diagnosed with ADHD that was never previously identified. And a lot of what I'm hearing kind of anecdotally from them is that they're they always had these experiences. They always presented with symptoms, even from early elementary school. But because they maybe got good grades or weren't troublemakers, it never went noted or identified. And so now as adults, they're struggling with not just ADHD, but also some sort of emotional dysregulation like anxiety or like other sorts of mood difficulties because of that shame and guilt that we were kind of talking about before, that may sometimes, not always, it's, kind of hard to make generalizations like that, but a lot of times that is what happens for young girls that don't get the support that they need. They grow up to be women who are very anxious and people pleasers and have a really hard time setting boundaries and saying no when no is the best response.
Oh, yeah. So I'm going to try and stay true to our outline, but let's remind me to go back to that saying no part, because impulsivity is a huge piece of ADHD, right?
Yes.
And it can look very different in boys and males versus girls and women.
Yes.
And the other piece is that that guilt and shame. Like, I think that's one of the reasons that I wanted to bring this into here, because we know that there's actually research showing that the way that girls internalize not keeping up, not succeeding, always getting scolded at, not being noticed, they internalize it as guilt and shame, and it shows up as, oh yeah, well, like I'm bad at this, like, oh, that's hard, I'm not going to do it. Or it can also be like internalized, which I thought was really interesting. They become like that overachiever, like girl that wants to study at all costs. She's up all night and she's redoing it and it's never good enough. And as we know, either one of those, they might get you an A on the test or the paper, or they might make you not feel bad when you get the bad grade, but they don't really help you become
kind of function joyfully in life,
Yes. That's what I was.
Because so much of like life is, okay, yes, we can do it. We can get the task done, but is it enjoyable? Are we like having a fulfilled or flourishing sort of lifestyle, or are we just like surviving to get the grade?
Yeah. And at what cost did you get it done? Right. Because sometimes the cost can be really, really high. So the three things that we're going to dive in here, so you guys know what to expect, is we're going to talk about ADD and ADHD specifically in girls, right? A lot of what we're going to say today can be for, boys and girls, males and females, for everybody who has ADHD or ADHD-like symptoms. But we're really going to dive deep into girls. The other thing we're going to talk about is, and this is why, we have Dr. Meg here, and she is the go-to person for one of the ways to get diagnosed, right? So we're going to talk about diagnosing, formal ways of diagnosing, informal ways of diagnosing. I don't know if there is a best way, but, maybe we'll piggyback into that. And then we hope to leave you with what can we do now, right? We don't want to give you all this information and then you're like, okay, Google now is my best friend. We want to leave you with something that you can walk away with so you can put into your life today. Nothing complicated. Trust us. It's going to be fine. So with that, I'm going to let you answer the question. What is ADHD and what does it look like in girls?
So ADHD stands for Attention Deficit Hyperactivity Disorder. In the most recent version of our diagnostic manual, it's called the DSM-5, they did away with the term ADD to describe attention deficits without hyperactivity. So now everybody has ADHD. That's the terminology that's used now. And there's specifiers. So you can have ADHD hyperactive type, inattentive type, or combined, which means that you have kind of tendencies for both hyperactive and inattention. And there are several criteria to meet eligibility or to kind of meet that diagnostic criteria, including different points of inattention. So hard time focusing, difficulty concentrating, a hard time with executive functioning skills. So things like planning, organization, initiating tasks, keeping track of like pacing and time management, like how long tasks actually take you. Things like that would be kind of descriptive of ADHD as a whole. For inattentive type, you'll see more kind of spaciness. So like more distractibility or difficulty concentrating, whereas with hyperactivity, In girls specifically, you might see more talkativeness, lots of socialization. In boys, you might see a lot more like physical movement. So like acting out, having a hard time staying in their seat, running around all over the place, climbing on things that they're not supposed to be climbing on. Girls can also exhibit those, but I'm finding more in my practice that I'm seeing a lot more talkativeness, interrupting in conversation.
I'm going to interrupt you now. So
yeah, go for it.
Talk about the talking too much, because I'm seeing that all the time too, and I'm just like,
yeah. So it's
let's talk about talking too much in girls with ADHD.
Yeah, it's so interesting because the talking too much is a judgment that like we as the adults or the people that are like observing are placing on the girls.
What's too much?
Yeah, right? It has more to do with, at least the way that I like to think about it and conceptualize, is if the child is talking a lot about something of interest, and it's like the right context, the right place and time for that conversation to be happening, then like go for it. But at the same time,
of interest to them, or like what's happening in the room.
Well, in context, right? So if we're like sitting at a birthday party and the little girl is sitting with her friends and they're talking about, I don't know, that they can jump in the pool in different ways and it's so cool. They can do cannonballs or one of them can dive. And maybe your girl with ADHD loves being in the pool and knows a lot about different types of jumps, right? Like in context, it might be talking a lot. She might be dominating the conversation, but it still kind of fits within the like
topic, right?
Right. So it's when we are seeing girls that are talking about jumping in the pool in the middle of a math lesson that maybe we are like, what is going on in her head? Where is her head at? Because it's clearly not on math. So there's lots of like internal distractibility with girls with ADHD, whereas with boys, you'll see them more externalized. So girls, you're more likely to find internalized, like racing thoughts or having your thoughts everywhere, thinking about not just what's happening in front of you, but like what happened yesterday or what's going to happen tomorrow or what you're having for lunch, right? So there's like internal distractibility as well. That is not visible.
Right. So then that internal distractibility to us, to the adults, to people in the room, to even their peers could look like they're just like ditzy, spaced out, not interested, lazy, not engaged, all of those things.
Absolutely. And it can also make it hard to get started on things. So like we were talking a little bit about initiating tasks, specifically with girls with ADHD. It can be really hard to kind of organize their thoughts in general because they're so distracted internally. So it can be hard to organize, like, okay, to do this worksheet, I first have to put my name on the top and put the date and then do number one. But that's organization, right? Which is typically very difficult for everybody who has ADHD. But then on top of that, they have to selectively attend to the task, right? So they have to ignore the unrelated thoughts that they're having or the unrelated input from like somebody drops their pencil or if somebody's walking in the hallway in school. They have to ignore those things and focus specifically on whatever the task is, which is also something that's hard for them.
So what would distinguish somebody who does these things you're describing to a point that they have ADHD that's diagnosable versus a kid who doesn't really want to learn about the clouds and got like a new puppy and I'm just thinking about my puppy? And then, so describe
the super good question,
right? Because it's always like a lot of those things could be, we all have versions of those, but what makes it, a real diagnosable?
Yeah. Super good question. Super good question. So I would say the like diagnosable answer, right? So when we look at the diagnostic criteria, we're thinking about the impact on daily functioning. So like daily performance. For young girls, that is more than likely going to be their ability to do things at school and at home. Those typically are their two kind of settings. When we're talking about diagnosing ADHD, these difficulties or the attention difficulties, the impulsivity or hyperactivity issues have to be present in more than one setting. So it can't just be that at home they never listen to mom and dad, or they always forget to clean their room, or they're messy, right? It can't just be at home. It also has to be evident at school and vice versa. So if at school they're not paying attention, or they seem bored or distracted, but at home they follow every direction and they're perfectly fine, then there might be something else going on that's possibly not ADHD. So we want to look at the presence of the difficulties in multiple settings.
I like that. That's a good, like, in more than one setting. We need to see these.
Yeah. And those settings could also be like, if they play sports. So like if your little girl plays softball or soccer and she's out on the field just like looking around and misses the ball every time, then that is another setting other than, home. Or so it could be like at taekwondo or at dance class or in piano or wherever other kind of extracurriculars she's involved in as well.
And what about if it's something that they like to do versus something they don't like to do? I always say, especially when I'm talking about executive functioning skills, like you'll see it show up even when it's something they really wanted to do. So preferred versus non-preferred tasks. Like I see struggles happening in both areas. So, okay, sure, it can happen, to start a history essay that I don't really care about, but it sometimes also happens when I'm in ballet class, like I missed the cue, or if I'm at football practice, I call the wrong play, and I really love these things.
Right. So what's interesting about specific interests or things that are enjoyable for girls with ADHD specifically is that a lot of times the internal distractibility or the difficulty initiating the task gets in the way of just beginning. But what I have found is that a lot of times once the task has already started, so say, for example, you have a girl who loves playing video games, and she comes home, she does her homework, she does all the things she needs to do, and then she goes to sit down to play her video games, but like she just can't get started. But once mom comes over, turns on the Xbox and gives her the control or whatever, mom sets up everything for her, then she gets started and she's like super into it and you can't get her off, right? Okay. It's that process of getting started a lot of times that impedes the like ability to engage in the activity of interest, if you will. So like what you'll see a lot of the times is parents will come and say, I can never get her off the computer, or she's always on the tablet. And that kind of hyperfixation on things that are interesting for them is also very common with kids with ADHD. So whereas things that are more mentally taxing or difficult, like getting started on tasks, doing homework, doing chores, are more mentally taxing than doing something that you enjoy and you know a lot about.
Yeah, interesting. And I kind of like that example of using the Xbox or a video game, because like that's almost like tongue in cheek, right? Like when is it that you have the parents saying, oh, let me get you started on your Xbox video game? But it's a great example to show that task initiation will show up in so many areas. It's not just in things that they don't like to do. Yeah. So, I guess in general terms, I feel like, we know that girls sometimes get harder to get diagnosed, and not even just, as an OT, like people always ask me like, oh, do you think they have this? Do you think they have that? I can get away with saying they may, and they may not, but I still see that they're struggling with task initiation. They're still struggling with focusing to things that they like and don't like. They're still struggling with, doing things on time. They're still struggling with all the things that I work on. So I guess there's a lot of like, so I don't want to just say like officially, diagnosed, but, girls we know don't get enough support or help because they're very like quiet. Yeah. Because they're in that, constant, self-distraction. They really try and kind of follow their peers. So a lot of times they can catch on. So it's not like, and again, we understand this is not all the cases, but it's not like your typical ADHD hyper boy that's getting in trouble, that's having detention, that's, maybe throwing things, breaking things. Wanted to find out other ways, like if we don't have a client or somebody, if you're a teacher, you have a student that maybe doesn't have the privilege or the resources to get a full psychoeducational evaluation with a formal diagnosis. I guess maybe compare formal diagnosing versus like informal. As an occupational therapist, a lot of times people ask me, "Oh, do you think my child has, ADHD? Do you think they have autism? Do you think they have Asperger's?" And I do not have to get to diagnose anybody. I'm so happy about, but I do help based on what the areas that they're struggling with, right? So
Yeah.
my answers to the families are, they may and they may not, but and there's value in knowing the official answer. But regardless, we know they're struggling with task initiation. We know they're struggling with being organized. We know they're struggling at home, at school, on the playground. So whether they are or they're not, we're seeing A, B, and C. And the main thing is that you are here getting support. So can you share a little bit about like the diagnosing, not necessarily the process, but if we can't get the psychoeducational test, like what are other ways that we can get that diagnosing? And even how do you feel about, there's so many like self assessments, self diagnosing quizzes. And one thing is that sometimes people don't want to do all that. Sometimes they can't invest in all that. Sometimes they might be in a situation where they don't have that accessible to them. So chime in on that, because I think that's super important.
So I'm like having a couple of different thoughts immediately. So there are definitely ways to get a diagnosis if you suspect that your daughter specifically, or your child in general, has ADHD. Most of the time, parents' first stop is going to be their pediatrician, and parents will raise their concerns about the things that they're seeing at home. A lot of pediatricians aren't very well trained in differentiating ADHD, like clinically diagnosable ADHD, from kind of typical levels of difficulty. And the other portion there is, with a pediatrician, you're only getting the input of the parent. So that's only one setting. So a pediatrician is a good place to start, especially if you're having just like some concerns, you're starting to notice some things going on with your child. It's a good place to go to have like a more formalized conversation about what a doctor thinks. So another thing to do from that point is, if your child is enrolled in a public school, have a conversation with the teachers. Get information from your two different settings, because you as the parent have that opportunity, and bring all of that information to your pediatrician. Most of the time, that is going to be the easiest and the quickest way to obtain a diagnosis formally for your child if they do struggle with these different aspects of ADHD symptomology. And the reason why I think diagnosis is important is because it gives you access to interventions. It's tough because
it is tough
in life and in like training, when we're talking about sort of supporting children, especially in school, we learned that diagnosis or eligibility shouldn't drive the interventions. So if you're struggling, you should get support for the areas that you're struggling in. But unfortunately, that like education.
Can you say that one more time? I'm trying to compose my facial expressions here.
It's so difficult. It's so difficult, because if you're struggling with something, you should be able to receive support for that area of difficulty,
regardless
of diagnosis, or if you have the ability to get a formal evaluation, whether that's privately or in school. A lot of public schools, of course, will do the evaluations for quote unquote free, because they're enrolled in a public school. But it's difficult because schools will still require some sort of medical documentation of a difficulty in the area of attention before providing support, for the most part. So that's where diagnosis becomes very important. And it can be very hard for parents to kind of come to a doctor and be like, something is up with my child. we don't like to diagnose our kids or say that our kids have disabilities. And unfortunately, in the kind of way that the system works, without that diagnosis, you're kind of barred from a lot of support. So diagnosis is definitely important. And pediatrician is definitely the easiest, quickest way to go. If you're able to come to a psychologist, specifically, I think school psychologists have the best training in assessment. Clinical psychologists, although they do a great job with completing assessments and writing reports, have less training for the most part in assessment. They have more of their training in therapeutic services. So school psychologists have a unique strength in being able to identify kind of learning disabilities and ADHD and other learning related difficulties, because we have higher training in those areas. So if you're able to get support from a school psychologist or a psychologist in general to get a more kind of comprehensive look at the academic areas of weakness, your intellectual weaknesses and strengths, and kind of look at the whole picture, that's also an option. Many school psychologists, like myself and some of the other people in our practice, we will also do brief evaluations, which will just look specifically at the social, emotional, and behavioral areas of difficulty. And we'll use like rating scales and interviews to get academic information and intelligence information from the family and from the school. So it's a shorter evaluation, but it's still typically much more formalized and has a lot more data than if you were to go to a pediatrician.
Yeah, for sure. And what about the avenue of a neurologist?
So neurologists have really nice tools. Specifically, there's one particular test that I see a lot in my practice. It's called a QB test, which is one way to kind of look at the way that your brain responds to different stimuli and how it reacts when you're paying attention or if you're impulsively responding. It's given on a computer. So it's
when they have to tap the quotient, that they have to tap with all the dots coming out.
Yes. Oh. That's one that I've seen a lot of neurologists use.
I think that neurologists have it actually.
In my clinical practice, like when I was in training, we used to give the CPT, which is similar. It's a computer-based test to kind of assess focused attention and hyperactivity. But it's just one measure, right? So when you're talking about diagnosing ADHD, it's really important to not just use one data point. So neurologists can provide a unique kind of viewpoint because they have a lot of that brain-based knowledge of how the brain works. They can do brain scans if they deem it necessary and provide that QB test, which can be helpful in making diagnostic decisions. And they can also prescribe medications should be required.
What I wanted to ask you was ADHD, because you said that the neurologists have a lot of brain information. ADHD is a brain-based diagnosis.
Yeah, experience.
Experience. I like to call it an experience because whether it's diagnosed or not diagnosed, you are still experiencing it. Yeah. I went to a workshop one time, I can't remember which one it was, and she talked about it was on dyslexia, and it was the lived experience of living with dyslexia. So I think about this with all of the things that we help our kids with, living with struggling with attention, right? Because it affects you in so many ways. Yeah. And I guess also too, like, isn't there also valid in, okay, maybe you don't have the diagnosis or you haven't gotten the diagnosis, because in order to go to all those things, somebody had to have brought it to your attention, right?
Or you had to have noticed.
You had to have noticed to even get there. But, I'm hoping some of the things we said earlier, which were the constant, the talking or the really, quiet, spacing out, and even you seeing them struggling in two areas. Hopefully those three things, I think those three things are really good things for a parent or a teacher to keep in mind, so that they're a little bit more confident in saying, hey, I'm noticing that Mary has a hard time, during music class, which she loves, and math class. I'm seeing that Mary has a hard time because she just becomes really quiet and doesn't, chime into class. And I'm seeing, so having those things so that they're a little bit more confident in having that conversation with the parent, right? It's not like, a lot of times the teacher's like, well, who am I to say that they're struggling, that they have ADD? Well, the only people that can say you officially have ADD are, let's say the neurologist, the psychologist, and, the psychiatrist probably,
yeah,
right?
the doctor of some kind, sure, yeah.
But we can definitely say we see your child struggling with attention issues. And using those 3 points that we talked about, I think are a really good takeaway from our conversation today, right?
Yeah, even just like as a jumping board too, because there's so many different ways that ADHD impacts your life, so much more than we have time to talk about here. But there definitely those like 3 key points of multiple settings, talkativeness, and kind of a hard time managing executive function. So initiating tasks, even with things that they enjoy. So those were really the kind of the top 3 things that we talked about before, but there are so many different ways that especially girls with ADHD can be impacted, not just academically or behaviorally, but socially as well.
Which is actually, that was my next on my outline. So, a lot of times the families, parents and teachers are like, okay, well, everybody has ADHD, or like, oh, my husband has it, my son has it. It's fine. It is going to be fine. I'm here to tell you it will be fine. Everything will be fine. This is totally doable. We got you. But I did want to talk about some of the things that happen specifically to girls and women when they have this diagnosis or this experience of struggling with attention. I'm going to say that from now on, because everybody doesn't have a diagnosis that struggles with these things, right? So a lot of the things that we see, your typical ADHD person is risk taking, right? So, in boys, it's like, driving fast, maybe drug use,
jumping off tables.
Jumping off tables, climbing trees, firecrackers, typical, boy stuff, even though I hate to say that. And in girls, a lot of times what we see that risk taking looks like maybe, how they navigate their friend group, right? Maybe how they start navigating romantic relationships, risk taking more with sex, and that's definitely, I know it's 2022 and we've come so far, but stereotypically in the world we live in today, still, I'm not saying that I agree with this. That's my disclaimer here, that it's still frowned upon terribly for girls to be promiscuous at an early age compared to boys. Okay. I'm not saying I agree with this. We can agree this is still the norm today. So we see a lot of that's what risk taking can look like in them. And then we also see that they figure out, well, since I'm always screwing this up, it's easier for me not to take any risks and not to do anything because I'm bad at this and I'm bad at that and I'm bad at drawing and I'm bad at following directions. So then we also see this, oh, poor me, I can't do anything symptom.
Yeah, it's interesting that you're talking about like risk taking in general, because we do typically see more risk taking in boys with ADHD or girls with the hyperactive type of ADHD who have difficulty with impulse control. Girls who have more inattentive type ADHD, I would say, are actually more risk averse because they're so fearful of doing it wrong or not getting it right. Or maybe I've tried it a bunch of times before and I just can't get it. So what's the point? Right? So they're actually a lot more likely to kind of avoid the risk or avoid the task altogether than to try new things.
And then I see a lot, it becomes like, oh, I can't do this. This is hard.
Right.
And then it's also that learned, I think that's a term, learned helplessness. So either one of those two are what happens when you're living with this struggling with attention experience and doesn't get helped and addressed. And then we wrap that up with guilt and shame that and this is from, I'll pull the book here in a minute. I did a little bit of research. Guilt and shame specifically for, I'm not saying that men and boys do not have guilt and shame. I'm saying that it shows up more in girls and women because they feel so bad that they keep screwing up, or they feel ashamed because they did this crazy thing and now like everybody's talking about them in middle school, or
if you think about like the research that we have on ADHD to date, most of what we have noticed in differences between girls and boys is that girls struggle more interpersonally and relationally than boys do. And it's just interesting because with boys, the inattention and the hyperactivity presents in your like classic symptom kinds of ways, right? Like, and so we're really good at identifying boys who have ADHD because we can see it. With girls with ADHD, those interpersonal skills are kind of you're not there when she's talking with her friends or not talking with her friends, or the other girls are making fun of her because she's really interested in dance and everybody else plays volleyball, right? Like we don't see that with our own eyes unless you're paying attention or unless she tells you. So a lot of those like social interpersonal difficulties you'll see a lot with girls with ADHD.
Yeah. And I think, because, of the shame and guilt, and then you end up with, I'm a pleaser, I'm just going to make everybody happy at all costs, and you can see their trajectory of how they grow up to be women and how they show up in their families and in their communities and in their careers. So there is a lot at stake here, and we really do change the trajectory of their life, their family, their communities, when we are able to identify, whether it's formally or informally, and provide some really good strategies and support for them so that we can try and just mitigate this risk. I mean, I think ADHD, boys, girls, it's a lived experience from day one to to the end. But we can definitely get in there and help them navigate, and then eventually be advocates for their own self, right? Because that's what we want to do. Right?
Because that's the goal of everybody, right? Like you are, as parents and teachers, like it's our, and people that support children, it's our job to help them grow up into functioning members of society. So that's definitely
not just for them, but for society. Like it's just going to make you grow up to be awesome. You're going to make society awesome, and then you're going to do what you were put here to do. So it's more than just that spelling test. It's more than just the math test. It's more than that college that they get into. This is really about their whole lived experience as a human.
Absolutely.
This got really deep right there. So let's get into the like, okay, now what? We already talked about what it looks like, how you can confirm or non-confirm, what you think is going on. So what can we do? Like, what can the families do? What can the teachers do? I'm going to chime in a little bit and then we'll bring it back to you. Like, I always think the first thing that we need to do as adults, professionals, caretakers, grandparents is really, and that's a benefit of knowing that they have this ADHD thing, because then they're really not out to get you and drive you and your family insane. There's something in their brain that this is how they are. This is like their DNA. And that just does a huge shift in your perspective, right? Versus, and when you do like your therapy with the families, I'm sure you have to spend time with the families saying, okay, this is what it looks like. It's not their fault that they keep doing the same thing over and over again. So I think, without going overboard, but learning about it so that you can really change your perspective as the parent and as the teacher, because it's literally, don't you think it's the only way you're going to really be able to help them, right? It doesn't mean we're not going to get mad and be like,
of course, we're people too, right? But at the same time, the knowledge gives room for grace, right? So like, instead of automatically jumping to like, sit down, why can't you ever sit down? It turns into, hey, Susie, like, take a seat, right? Like the prompts maybe are gentler and there's more space for understanding and compassion. Whereas if you didn't know that it was ADHD, you would just think that your kid's being annoying as anything.
Yeah. It doesn't mean you're still not going to get annoyed, and they still will annoy you. And you might still think, oh my gosh, why can't they do this? But, your interaction will hopefully, you can pause a little bit and give yourself grace and give them grace too.
Yeah.
And so the perspective I think is huge. And then the other thing that's kind of like where I start when I have kids come to me, whether it's ADHD that they're struggling with, or anything else, and even if they have the ADHD diagnosis, or they just have this lived experience of struggling with attention. I'm gonna like trademark that, the lived experience of struggling with attention. It's kind of long. Or the other thing is find out what they're good at.
Yes.
Because by the time the kids have been identified by a teacher, pediatrician, family, neighbor, grandma, your sister told you better get help for this child, the kid has already messed up over and over and over, and they already have this negative, like talking about executive functioning skills, their metacognition skills are like, oh my gosh, you are the worst. You're the worst. Yeah. So finding out what they're good at, again, will change their perspective and their ability to have like some more positive experience. Like, because the only way you build self-esteem is with positive experiences.
Yes, absolutely.
It's not with us giving them a sticker or a trophy or saying, I'm so proud of you. It's by them going through the thing and completing the thing. So if we can find the thing that they're good at, I feel like we can mitigate sort of stuff that comes with it's of the 10. And sometimes I tell it to the parents and they're like, what? Like, what do you mean? Because they're so used to, okay, we need to get a tutor for this. You need to get a coach for that. Or, let's get help with the things that are bad. And then, so maybe chime in on those two things, like your perspective and, figuring out their strengths. And then of course, once we figure it out, we do need to support them in the areas they're struggling with. We can't just leave them high and dry. So that's my go-to.
Yeah, I definitely think that psychoeducation, education about ADHD and how it's influencing your child and your family specifically is going to be the best way to get started. Just like learning about it, learning about like its impacts for your child at their developmental age, and then kind of looking forward to, so you can start thinking about like what it might look like in the future. Because if you think about a child in 1st or 2nd grade with ADHD, it's going to look really different than a child in 4th, 5th, in middle school and in high school, because the demands for executive function is different.
And in college.
And in college, and just like in life, right? So kind of thinking forward a little bit without overwhelming yourself too much, because it's very easy to go down that rabbit hole. But kind of think about learning as much as you can about ADHD in general and how locally it is impacting you and your family unit and your child. And then the other thing you were talking about was, I already forgot.
It was their strengths and your perspective, and then their strengths.
Thank you. So strengths and weaknesses, super, super important. It's very easy for us to kind of look at our children under a microscope of their weaknesses. And especially when you're talking with medical professionals, with school, it's really easy to ignore all the things that they're great at. And because there's so much need a lot of times in supporting their weaknesses, what gets thrown to the wayside is all the things that they like to do. So instead of going to Taekwondo, we have to go to math tutoring, right? And so there has to be a balance. You got to learn to strike a balance by supporting their areas of strength just as much as their areas of weakness, because it will boost that kind of self-concept. It gives them this feeling of accomplishment because they can do something very well. They are good at one or several things. And this one thing that's hard for me isn't my entire being. Like, it doesn't define my whole identity. I am more than just this one area of difficulty. And that's really important to communicate to our kids. And it's also important for us to think about as adults too, right? Because when we look at our children who are struggling, it's easy to see all the ways they struggle, and it's harder to focus on the things that they're great at. So it helps us to change our mindset a bit too.
Yeah. And I think that's very powerful in looking at like sometimes actually, and this may be a little controversial, but that's okay. Sometimes when they come to me and they try this and this and this and this, sometimes I'm like, okay, I need you to stop everything and find out what do they like to do? What are they good at?
Yeah.
And then when you find it, I want you to do only that. Just that. Because sometimes you have to like almost like reset and like
Yeah.
Reboot.
And it really depends on the family. I think it really depends on the family, because if they're struggling because they're trying to implement too many things all at once, then you're overloading your poor babe. So
It's not sustainable.
pick one, right? Like, you're driving yourself crazy because you're trying to do 10 things to try to support your child, and they're also going crazy because they have to remember the 10 things that you're trying to do to support them. So choosing one or two things that are going to be the most effective is going to be really important. And for girls specifically, I wanted to mention that a lot of the times, because the difficulties that they experience, like interpersonally and socially, what they desire most is social connection. So for girls specifically, depending on kind of what's presenting symptom wise for your girl, thinking about reinforcers or positive experiences with people. So I remember when I was working in a school, I would have a group at lunchtime for all of my girls with ADHD. And we would just eat lunch together. Like, it wasn't teaching time. It was just like social time to be able to be together because they were doing so well. And that's very reinforcing. Whereas for externalizing behaviors, like you see typically in boys, a behavior chart might be better to help them remember, like, this is what you're working for. So keep your hands to yourself, or keep your butt in your chair, right? So that's something to think about too in terms of strategies for intervening.
Okay, I love all those. Okay, so one thing I wanted to talk about before we wrapped up here is, back to it takes a village. So, a lot of times the family will come to me with one of the beautiful reports that your colleagues, you or your colleagues have done, and I know that they read it, and I know that they went over it and they were asked, do you have any questions? And of course, it's natural. You get all this information and you're just like, maybe you ask one or two questions, maybe I'll call you and email you, but and then they're like, yeah, I haven't read it in a long time. What do I do? So I think a lot of times is, as far as like now what to do, and this chimes back to what you kind of just said, pick and prioritize where you're going to start, because even if you can improve that 1% consistently over a month, 6 months, will really make a huge impact in how they're functioning, right? And a lot of times it takes trial and error. And I don't want families to give up because, we tried this and it didn't work. Maybe
there are also different, like, sorry to interrupt. There are also different like methods of like strategy, right? So we were talking a little bit before and you asked me to remind you, but there's medications, right? And then there's like behavior strategies and other kind of social strategies that we could employ. And the research shows us that the best way to manage ADHD symptoms is by doing both. That's where the best sort of outcomes are.
Just to clarify, and I'm being like tongue in cheek here, the research doesn't show that only one works. So let's say they only want to do, psychotherapy. The research doesn't show that only one. The research shows that, intervention with medication, if that's what's needed, works the best.
That's a good clarification. So the psychotherapy or behavioral supports alone, you will see improvement, of course, because you're intervening, right? Medication alone, of course, you will see improvement because you're intervening in some fashion. But what research shows us is that both together is the best solution. And by and large, the reason for that is that medication provides your brain with the stimulation it needs for you to be able to receive the behavioral support and interventions so that you can actually learn and use them. So it kind of like gives your brain a break almost and lets you receive the learning and knowledge to help manage your symptomology. A lot of times what parents will do, and depending on kind of your family ideology and how you feel about medications in general or therapy in general, some families feel way more comfortable going straight to medication and not doing therapy at all. A lot of other families, at least most of the families I encounter, prefer to do a course of like 6 to 8 weeks of behavior therapy and parent training before considering getting more information about medication. There's no real right or wrong way to go about it. It really is very individualized. A lot of families are very fearful of medicating their young child, which is absolutely understandable. And then other families have lots of stigma and fear surrounding going to therapy. So it really is kind of a family decision to support your child in the best way that you're able. But the research does show us that a combination of both medication and therapy is the most effective way to support children with ADHD.
Yeah, that's what I've learned as well. You know, like the and this isn't true for all of them, but you know, the pills don't teach skills, right? That's the
Exactly.
like mantra or whatever.
Yeah.
So, and do you find any difference with girls versus, you know, how girls react to medication versus, I know because some kids, they take it and it's like, it's night and day.
Yes.
Yeah.
So
those I feel like are the easy ones, right?
Yeah. I think it really depends on the girl. So it's hard to make generalizations. But I think that for your inattentive girls, it provides clarity because that like mental, like all those thoughts racing around in your head, they like get quiet. The way that I've heard it described by some of the girls that I see, and also some of my peers that I was mentioning earlier that are getting diagnosed as adults, is that there's just like clarity and focus. Like it doesn't take them 20 minutes to get started on things. They just wake up and do it. That they're just able to get started immediately. Their problem solving is easier and faster and better because they're not struggling to weed out all the other things that are going on in their head. For your hyperactive or impulsive girls, I see a few. I don't see as many hyperactive or impulsive girls. But they typically will express to me that they feel like more fatigue. So like they're behaviorally suppressed, which is the intention of the medication. So it really is going to depend on the girl, her age, the medication that's being used. So there's so many factors with medication management, and I'm not specifically or uniquely qualified to discuss those sorts of things. So that's definitely a pediatrician, neurologist, or a psychiatrist.
I always say that you know, I don't decide if you medicate your child or not medicate your child, but I do feel that we provide data, information as to how your child functions, you know, so that, you know, the parent and the physician can make that decision together. And we can just provide data and information. So one of the things you just said, which I was going to, so, you know, okay, obviously medication, let's just throw it out there. That's one of the reasons. Therapy with, you know, with somebody like you can, you know, help them work through a lot of these symptoms.
Or someone like you.
and then I was going to say, and someone like me. The difference I think is, well, there's a lot of differences. I mean, actually occupational therapy was based originally in mental health, which a lot of people don't know that. So, and there's actually a movement for occupational therapy to do more mental health than we have, let's say in the last 20, 30 years, because there's such a huge shortage of clinicians and there's such a huge, more identifying of people that have mental health. Okay, that's side note. But when they come to see me, I want to say, and I just got this light bulb moment now when you were speaking, is I think that the girls that I get that are living with this attention, maybe are more the girls that have that hyperactive component. So you see it more physically, which is why they would end up either being referred to occupational therapy or seeking occupational therapy, because there's more of, you know, we'll see the processing speed issues. We see the body awareness. We see the motor planning coming in because of, you know, the ADHD. We see a lot of that sensory piece come in. And I definitely see a lot of the talking, happening. Like, so yeah, with occupational therapy, we will still, I will look at the same thing with all the kids that come to me, whether they're teenagers, adults, I mean, you know, college students, and then I will pull out information that I need.
Right, of course.
Typically with girls with ADHD, I see a lot of the chattiness, the self-distracting, the things are, this is too hard, or I can't do it, or you do it for me. I see a lot of the processing speed interfering with what they're doing. task initiation because of the self-distracted thoughts. So a lot of times we have to backpedal and start off with how can they use their body in space? How can we get them feeling more confident in their body so they're not necessarily having to wiggle and move. A lot of having them experience those things that will build that self-confidence even within my little realm, because once they start experiencing this is hard, I don't want to do it, but I did it and I did it right. So my job is really finding them that just right challenge. And then there's because that's more valuable than anything I could do. Once they figure that just right challenge, of course I'm working on all the other things. They all of a sudden are more able to experience more wins, and they get that feedback as to, oh, this is how I'm supposed to do this. And then I have different programs that I work with specifically for ADHD, which is I showed you one day the NeuroNet, and I'm also bringing on interactive metronome, and they work a lot on the timing of the brain, which there's so much research on. The better we get our timing to move, the better our brain can function, and then can function. And then there's of course the parenting piece. Like I love to bring the parents in and kind of help them navigate their afternoon routine, right? Because their medication is done at the end of the day, so that afternoon routine can become very challenging. So looking at them through the occupational therapy lens of how is this child going through their day with this experience of struggling with attention, I really find super satisfying, and I love getting the feedback from the parents and the kids to do better. So I think all the pieces, but I do think the parents need to prioritize. They can't do all the things, right?
You cannot do all the things at once. And I think that I usually would recommend like prioritizing the location that the child is struggling in the most. So like providing interventions that is going to support the child in that location with the most intensity, and then do the same thing at home so there's continuity, right? So like, for example, if a girl is having a hard time focusing in class and the teacher is prompting her or giving her a nonverbal cue, like tapping her on the shoulder to make sure that she's listening, or giving instructions to the whole class and then to her directly, doing those things at home also with siblings, pairing them, doing it in both locations or in all locations as much as possible, like in extracurriculars and such. It can become challenging because there's limits to what you're doing, right? If you're an outfielder in softball, then your coach is not standing right next to you telling you, hey, don't forget to pay attention. But there are certain ways that you can accommodate and use similar strategies in all locations that will be really helpful for continuity.
I love that, Chip. Yeah. The whole thing is challenging. It's not easy of this, but it's definitely, once you can figure out and prioritize, just keep in mind for those of you watching this, that you really can change the trajectory of how this little girl shows up in her life as she grows up. All right, let's do it. Okay. So do you have, and just try and give me like a 1 sentence, 1 word answer. Do you have a go-to test that you use for diagnosing ADHD in girls?
The short answer is no, because you need lots of different sources of data in order to make a good diagnosis.
Okay, great. 1 fast myth. I know we've covered a bunch, but just your top myth about ADHD in girls.
That girls are lazy. The girls with ADHD are lazy, that they just have no motivation and they just don't care about doing well.
Medication versus therapy. Your quick wrap it up in 1 sentence, 3 words.
Both, but me personally, professionally, I would probably do therapy first and then medication.
Okay. Do you have a favorite book on ADHD, specific ADHD for girls?
So there's 1 book for the child. It's called Hi, It's Me, I Have ADHD. It's by, hang on, I wrote it down, Caitlin Mabry, Mabry. And I really like it's more like elementary school level. But I really like it because the author herself has ADHD. And so she wrote this like children's book to describe what it can be like. And a lot of what we've been talking about today is kind of in there. And it can be really validating for the little girls to like know that that's something that other people have too.
Oh, I think it's huge for them to know. I actually did another video. I'll link all of this at the bottom. And it was with a lady who had ADHD growing up. And she talks of growing up, not knowing she had ADHD because she didn't get diagnosed till she was, an adult. So it kind of ties along with this book. So my next question is, should parents tell their children that tell their girls that they have a diagnosis of ADHD?
So I would say pretty much almost always yes. Developmentally appropriately. But I think it's important for girls to know that they struggle with something and to have something to call it so that they don't internalize that they can't or they're lazy or that they're not able, but that it's their ADHD.
Okay. And then do you have a quick one-liner on how you tell your kid, by the way, you have this thing called ADHD. So it's just how you are, but we still, don't use it as a crutch. And because some people don't want to tell their kids they have it because then it's like, oh, then they're just going to use it as a crutch. And there is that stigma involved, but I find a lot that they don't want to tell them because then they don't want them to feel like they don't have to try.
So I think that using tools like that book that I mentioned, depending on the age of your child, is going to be so, so helpful because it gives them information without giving them like the way to possibly use it, right? I think as adults, we automatically think that kids are going to manipulate us if they know certain information, but manipulation requires a certain abstract level of thinking that many kids at the age that they're getting diagnosed with ADHD just don't have. So giving them the information can actually help them to internally feel more self-confidence and more capable of managing the difficulties. And you'll more likely see more positive outcomes by telling them that they have this diagnosable difficulty. And again, it really depends on their age. Like young little kids, I'd probably say, how it's really hard for you to pay attention.
I'm talking more about, like your 7, 8, 9, 10-year-old, a kid that I think.
Okay, so like a mid-elementary school kind of kid. Definitely going over, like there's this thing called attention deficit hyperactivity disorder or ADHD, and that's something that lots of kids experience. Kind of normalizing it to a degree is going to be really important because it's true. Statistically speaking, many children have ADHD. And so talking about it like that and giving them the different ways or symptoms that they are presenting with that describe ADHD, and then things to do that can help them. It's really a conversation. There's not really a good like 1 or 2 sentence answer. But that's something that like we can kind of help. We can definitely help parents navigate those conversations.
But I guess the takeaway is that there's more positive things coming out of telling them than the fear that they're going to be like, oh, well, I have ADHD, so I can't do that. Like, it's too hard.
Exactly.
So that's really maybe a myth.
Yeah.
It's a possible myth that's what happens. Okay, great. That's it. I have no more lightning round questions because we are at our max time, and I think this has been great. So you can learn more about Dr. Meg, and you are on Insta. Tell us where we can find you and all the wonderful things.
So I am on Instagram at Dr. Meg Terzulli, and it's spelled there on your screen. And then you can also reach me via email at mterzulli.prac, PRAC, @gmail.com.
And we'll put that in the bottom. So thank you so much for being here. I think this was so great. I think we're going to help a lot of people and help make everybody's life better.
I hope so. It was great being here with you. Thanks for having me.
Oh, you're welcome. So if you guys have any questions or comments, feel free to leave them below. Once we get this up and going, I can always have Meg come in if you have a question for her, and I can definitely answer any questions for you. And I'll try and pull in the resources at the bottom. So we have, we talked about a lot of things. So we'll try and keep it all there for you guys. All right. Have a great day.
Bye.